This morning we're going to get started right at 8 a.m., so right on time today. Thank you all for being here. It certainly means a lot, especially in light of what's going on in the world. And obviously, I know Israel's on all of our minds, and so it goes without saying that our hearts and minds are there, and just appreciate that we as Jewish people and people that support Jews can be together in one room in this community and be safe together. So thanks for being here. This is our annual Jewish Business Leaders Hall of Fame that we do once a year, and it's an incredible honor to be here today honoring Dr. Gold and UNMC. The reason we're at Happy Hollow, spaces on campus are becoming so loved that it's becoming a little hard to book there often, but want to thank Zoe Rikas for hosting us here. And also, it wouldn't be possible for these events without our sponsors, our platinum sponsors, Bridges Trust, Omni Partners, and Valmont. Thank you for being with us year by year and for every event. And also our Hall of Fame event sponsors today, UNMC and CFO Systems. Now on to our speaker today. I'm incredibly honored and humbled to be able to introduce Dr. Jeffrey Gold into the Jewish Business Leaders Hall of Fame. We thought it would be fitting after the last few years Dr. Gold could accept this award and talk about all the wonderful work both himself and the wonderful men and women at UNMC are doing each and every day here in our community that has shaped Omaha and is continuing to have a dramatic impact into the city Omaha is becoming. Dr. Jeffrey Gold is nationally recognized leader and tireless advocate for transforming higher education, academic medicine, and healthcare delivery. He became the 8th Chancellor of the University of Nebraska Medical Center, Vice President of the University of Nebraska System, and Chair of the Board of UNMC's Principal Clinical Care Academic Health Systems Partner, Nebraska Medicine, in early 2014. He has been repeatedly recognized as a top 50 healthcare executive and top 100 physician executive, as well as many national awards for leading numerous community volunteer programs, philanthropic campaigns, and programs. We are so pleased Dr. Jeffrey Gold's in our community, in Omaha, in the Jewish community, in the state of Nebraska. Thanks for being here.
Well, thank you so much. It is an incredible pleasure and honor to be with you this morning. I love the introduction. I only wish my parents were around to revel in it. I do get asked the question all the time, given the fact that I have held and continue to hold multiple different titles as Chancellor and as Provost and as many other things. What's my favorite title? I will tell you my favorite title is Grandpa, but there are only 2 special people that get to use that title. I thought a lot about what I would talk about for the next few minutes with you. Maybe just to start off by saying, while I am humbled and honored to stand before you on this Friday morning, it is really because of the individuals that I get to work with every day. Many are in this room. I was going to ask them to stand up, but they're enjoying breakfast, so I won't interrupt their breakfast. But the Med Center team is just an amazing group of individuals who are dedicated, thoughtful, caring, look at the communities and the individuals that we serve as members of our family. They don't care what color their skin is, where they grew up, or what their beliefs are. They just try to do the very best. And I'll tell you, having spent 25 years in the operating room doing cardiac surgery, when you're fixing somebody's heart, there's no way to know what color their skin is. There's no way to know where they grew up. There's no way to know what their beliefs are. All you know is one thing, is you're there to make them better, and that has been the focus, and that is certainly the focus of the Med Center here in this community. We've lived along the philosophy that every member of the community is a member of our family, and if we make decisions about the future, whether it's the economic decisions, growth decisions, workforce decisions, etc., any of those decisions that better the community make us better and certainly resonate widely across all of the communities that we serve in this 500-mile wide state, and certainly more broadly across the nation. But as I pondered the few minutes that I have with you this morning, I was asked to talk a little bit about my background. I was actually given 6 different talking points that I should attempt to address during my 30 minutes with you, and I'm going to try to stay on schedule as much as I can. Believe it or not, I'm actually later this morning welcoming the Secretary of the VA to Omaha, who's going to be visiting our services for veterans, which is an exciting opportunity to welcome Secretary McDonough and to better serve those that have worn the cloth of our nation. But, as those of you who know me well, there are many in the room that do, I don't do well when I'm scripted and asked to talk about things, and I do much better speaking from the heart, and so that's what I thought I would do with you this morning. But by way of background, I was actually born in the inner city of New York. I'm a product of a public high school system. It's a known fact that there are far more individuals in my high school graduating class that went to jail than went to college. That's a given fact, as a matter of truth. Were it not for scholarship support, and I would never have had an opportunity to attend a phenomenal university. I went to Cornell, College of Engineering, and people ask me all the time, why did I become an engineer first? And the answer was, I had an uncle who was an engineer who said, Jeff, if you tell him you want to be an engineer, you'll get a scholarship. And I said, what's an engineer? He said, well, you'll figure it out at some point, but just tell him you want to go to engineering school. And lo and behold, it worked, and I found out that I really loved that and used that as a platform to go to med school, had an opportunity to train in multiple surgical facilities, including New York Presbyterian, Memorial Sloan Kettering, the Brigham in Boston. Actually, the last training that I did was at Boston Children's Hospital, and spent the next 25 years of my life caring for patients that were about that big, and over 20,000 families during the course of my clinical career. And I can tell you it was one of the most gratifying things that I ever did. But came a day, 9/11, that we all remember all too well, tragically, that I got a call at about 8:45 that Tuesday morning from a very close friend of mine asking me if I would be willing to travel down to Chelsea Piers in New York City, which is on the west side of Manhattan. And they were setting up a triage center for casualties from the 9/11 plane crashes into the Twin Towers. And they said they were having a really hard time getting physicians who would be willing to do that. And so they asked me if I would do it, and I did, after a brief conversation with my wife, who basically said, Jeff, don't do anything dumb. And she chose other words, by the way, but that was the thrust of it. I had 2 kids in school in New York City at the time, and had the pleasure and honor of serving as the chair of a very prestigious department, and had a phenomenal clinical career. Actually, I was in the operating room taking care of a young lady that morning when all this transpired. And this was an individual that had been turned down in multiple institutions across the state and actually outside of the state, and we agreed to take care of her. And we had just come off cardiopulmonary bypass, just come off the pump, and she was doing great, and she did go great and go home, and I was feeling really, Jeff, what a great day. We, score, and then all of this transpired. And I lived down at Ground Zero for, actually not at Chelsea, but at the North Tower Triage Center, which was at Peter Stuyvesant High School, for 5 days of my life, until the Saturday morning following that the federal FEMA individuals arrived, and we were relieved from triage responsibilities and other such things. And that changed my life in many ways. It reminded me that you needed to do what you wanted to do and what you thought you wanted to do, because you never knew how many days you had left. And all those nearly 3,000 people all they ever did was got up and go to work that day. I will tell you that there were 80 members of our synagogue in New York, Temple Emmanuel, who lost their life on that day. Many of them worked for Cantor Fitzgerald. Attended, I cannot count how many funerals and memorial services. But the reason I tell you the story is not to aggrandize anything that I did, to the contrary, but to make the point about what terrorism really is and what it isn't. And that I learned very quickly that the way terrorism is really effective is that it changes people's lives. It forces them, it cajoles them, it inspires them for one reason or another to do things differently, to not do the things that they want to do, to not have a gathering such as this morning when the rest of the world is in so much turmoil and such great tragedy and atrocity that's going on. And so I bring this story to you this morning, and I'm going to talk about many other things in the next few minutes, but I bring this story to you this morning just to remind you that the way terrorists win is they force other people to change their lives. They take the joys out of your life. They separate you from your families. They separate you from your faith in many instances, or attempt to do so. And that's what we really have to guard against. It's those changes, because otherwise they will win. They may not win on the ground, they may not win in terms of how many square miles they may occupy or not, but they will win if we change our lives as a result of their actions. And so seeing you all here this morning on a beautiful Friday morning, and yes, please do notice that the sun did rise, and it will tomorrow, and the next day, and the next day, we should be energized and inspired, and of course saddened as well for so many reasons, but we should be energized to be sure that we in our lives and you in your lives continue to do what is so important to you. Thank you. Well, I just want to reiterate one more time that when I stand here today and have the opportunity to speak with you, I am truly humbled. I have a very serious case of the imposter syndrome, and if you were to look at my Myers-Briggs scores, you would see that I am a very deep introvert and have learned, you would not believe that, but I actually am. Maybe Myers-Briggs fails, I don't know, or Vision Stark, but I've learned to try to overcome that a bit over the years. You know, I am also asked if I would say a few words about where the Med Center is going, what I think the future looks like, where we've been over the last years. Hard to believe next January, excuse me, will be 10 years that I've had an opportunity to serve this community. And well, thank you. You know, I will never forget, J.B. Milliken called me up one Saturday morning, former president of the university, and said, Jeff, you know, I'd really like you to come out and visit us. We have this great job in Omaha, Nebraska. And I said to him, I only have two questions. One, why do they call you JB, and where in God's name is Nebraska? He told me to get a map and, you know, made a few comments about my knowledge of geography. You know, he said right in the center of America. But so I'll never forget, it was on my second or maybe third visit that I came out with my wife Robin, who, by the way, just celebrated over 40 years of marriage, which is you know, an amazing feat, and thank you. It's amazing how that happens, you know, you turn around and the pages just keep falling off the calendar. But I'll never forget that, you know, Robin and I were in the waiting area up at Epley Airfield, and I said, Rob, what do you think? And who knows me better than I know myself, of course, for those of you that have, you know, been blessed with a relationship like I have been. And she put her arms around me and said, Jeff, this is for you. And she was right. This has been an amazing ride, and frankly, the future that is ahead of us is so bright and so full of opportunity. So if you look at where the Med Center is today, we have increased our enrollment by approximately 1,000 students over the last decade. And by the way, again, I want to be really clear, none of that is due to me. What I get to do is work with amazingly talented people and the best thing that I can do is just stay out of their way and let them do their thing. And if I don't meddle too much and stay out of their way, success continues to ensue. And when we continue to provide workforce for the entire state of Nebraska as a public university and the only public medical school, pharmacy, dentistry, etc., we have an obligation to be sure that we serve the people of our state. 88% of our students at any time are Nebraskans, and that's very important. If we have young women and young men who want a career in the health professions, who grew up in Nebraska, whose parents live in Nebraska, siblings live in Nebraska, educated in Nebraska, that's probably the single highest predictor that we can keep them in our communities. And we're dealing with very, very serious workforce challenges. It shouldn't be a secret to anybody in this room that of the 93 counties in the state, 14 or 15 do not have a single primary care doctor. 49 do not have a single board-certified OBGYN. And some of these counties, are 100 miles across or more. About half of them also do not have a board-certified pediatrician. And if you look at the trends over the years, they're not going like this. They're going down. And that's one of the reasons we've invested so much in a public-private partnership with the programs that we're doing in Kearney, Nebraska, which you may have read about. That will be the largest health science education satellite program ever done in the United States, and is a partnership with the legislature, specifically using ARPA dollars and the private philanthropic community. It was about a 2-to-1 match, state dollars to private dollars, and as Amy knows, took us less than a year to raise the entire match, and it just shows you what a generous community is. And by the way, the overwhelming majority of that match did not come from rural Nebraska. It came from this city, it came from Omaha. And people in Omaha saying we need to do something about healthcare in rural Nebraska. Why? Because we care. And that's really been the underlying message of basically everything we've done. Our research growth has continued to be extremely prominent, and actually one of the most rapid rise in good news stories. What defines academic medical centers is not just that they produce the workforce for the future and produce high quality clinical care, but that we're at the cutting edge of science. And there are many in this room, several I could point to, but I won't, who are very, very prominent research scientists who are really pushing back the frontiers in cancer, in heart disease, in neurological diseases, etc. And we just are not going to rest until we can transform the way people are diagnosed and cared for and move away from treatment to cure. And just to stay on that point for a second, because I believe that is one of the themes of the future of health and healthcare in our nation. And to move away from health care into health is going to be one of the most important paradigm shifts. You look at what we spend per capita in the United States on health care, we're one of the highest in the world, if not the highest in the world. If you look at what we spend on health and wellness, we are actually in the lower third of the G20. So we're very good and very not terribly cost effective, but we do an awful lot on treating people when they get sick, but we don't do very much about preventing that sickness, whether it's emotional illness, medical illness, or combinations of the above. But I learned when I went to med school, and it got a lot, of course that's when the dinosaurs ruled the earth, and I do recognize that. My kids used to say, "Dad, did you have TV when you grew up?" I said, "Yes, kids, we actually did have TV. We did drive cars." And now my grandchildren ask me the same questions. It's amazing. They're 7, and they think they rule the world, and I guess they do. They certainly rule my world and my wife's world. But in those days, we did a very good job of treating disease, and today we do even a better job of treating disease. But if you look at the most common diseases that change life expectancy and quality of life, and I'm talking about things like hypertension, high blood pressure, diabetes, asthma, the really common causes of hospitalization, emergency room visits, etc., many of the mental health diseases that we're challenged with in our society, we treat them, but we don't cure them. And there's a major paradigm shift going on in an attempt to cure disease. That is to say, not to just continue to treat it and make people's lives longer and better through treatment, but to definitively cure it. Maybe that's one of the reasons I chose a surgical specialty, is I sort of liked the instantaneous gratification when you leave the operating room and a blue baby turns into a pink baby and will go on and live a normal life. That really meant a lot to me, to be able to see that transformation. Maybe it was just the impatience of somebody that wasn't interested in years of treatment. But I think that that paradigm is actually changing. And our research is focused in those specific areas. And I think that we are incredibly well poised, and not just we here in Nebraska, but I think globally. The technology is changing so quickly through the use of whole genome sequencing, through the use of something called cell-free DNA, which allows diagnostic testing at a stage that people may not even know they're going to get a disease. So I was just talking to somebody the other day who went through what's called a cell-free DNA test for cancer, was determined to have a genetic sequence that was picked up that was consistent with a certain type of cancer. This was an otherwise healthy, marathon running 40-year-old individual in this community, who of course will remain nameless, or at least until you buy me 2 glasses of wine, it will remain nameless. And ended up having malignancy in her GI tract, and had a stage 1A resection, which is a curative resection for that disease. And so I see that ability to have early diagnosis and early treatment. And we're working with a company right now that has a breath test that they believe will predict Parkinson's disease. Now, I don't know whether that's going to be true or not, but this is a Canadian company that believes that they can not only detect the very early predictors of Parkinson's and other neurologic diseases such as Lewy body disease and Alzheimer's at a stage that it may be treatable. And we're now better understanding what that treatment might look like. We're doing a lot of work in the area of pancreas cancer. And the reason pancreas cancer is the third, soon to be the second leading cancer cause of death in the United States is not because it's the most common. It's less than 5% of all malignancy in the United States. But it presents at a late stage when it is very difficult to treat, let alone almost impossible to cure. I mean, it's got to, when I went to med school, the life expectancy was under 5%, 5-year survival. Last year it was 12%, so we're getting a little bit better. But I mean, compare that to prostate cancer, for instance, that has a 95% 5-year survival. And that's because we've done a whole lot better at screening, early detection, and developed high-impact therapies. And so I think where the world is going is earlier detection, more focus on lifestyle as it relates to the quality of life and as it relates to early detection and early treatment and early cure. Because, if you look at the major breakthroughs that have occurred in the treatment of cancer, and just give you an example, 30 years ago, 25 years ago, for every child, for every 100 children that were diagnosed with a malignancy, 80% of them did not survive 5 years. And now that number is 10% don't survive 5 years. And why is that? Because we're better at diagnosis and we're better at cellular treatment of those diseases. And so we can give these young women and young men a completely normal life expectancy today. And we need to be able to do that same thing across many other different disease states. I would be remiss if I didn't also talk about quality and safety in healthcare. And as you may know, that medical error, quote unquote, is the third leading cause of hospital death in the United States. It's not to say that these weren't individuals who are otherwise quite ill and otherwise would have had limited or no life expectancy otherwise. As hospitals have really become, over a period of time, glorified intensive care units. You look at the acuity of care, what used to be hospitalization is now drive-by. You know, when I was a surgical resident, if you had your gallbladder out, you'd spend 7 to 10 days in the hospital, you'd get your drains advanced slowly, you'd go home with a scar about that big. Now, you know, a very close family member of mine had a cholecystectomy, came in, went to the operating room at 7 o'clock in the morning. At 9:30, we were driving home. Went to dinner that night. You know, it's a different world. And so what we do fill our hospitals with are people in older age groups, people that are chronically ill, and with a lot of different comorbidities. And therefore, the precision of the care, what happens if you miss a single dose of medication or error on a dosage amount, what happens if somebody gets up in the middle of the night to use the restroom and loses their balance and slips and falls, or spends an extra day on a ventilator in the intensive care unit, in the past would have made very little difference, but now those are life and death decisions that have to be made on a daily basis. We've done a lot of work with advanced simulation in the Davis Center, and by the way, if you haven't visited the Davis Center, you should definitely do that. This was a vision that we brought to this community, that advanced simulation and the use of augmented and virtual reality were actually going to change the way we delivered health care, and lo and behold, we are now one of the safest, from a risk perspective, institutions in the United States. You know, we compare ourselves not to every hospital in the United States, but in our cohort of about 103, we compare ourselves to Hopkins and Stanford and Mayo and Cleveland, etc. And for a very long time, we were roughly in the middle of the pack, and we're now in the top 10. And that is purely as a result of focusing on the fact that quality and safety, and of course patient experience is great for the patients and their families. I'm sure all of you know that have received health care anywhere. While it's very nice if it's easy to park and if the coffee's good in the lobby of the hospital, but at the end of the day, if you're being treated for cancer or heart disease, you want one and only one thing. You want the very best clinical result that you can possibly get. And that's where our focus is. I hope our coffee's hot, and I'm sorry if the parking's difficult because we're so busy, but at the end of the day, what we really care about is quality and safety, and of course the experience of our patients. So we have a saying, we say serious medicine, extraordinary care, and I just want to take a minute to just unpack that. And there are a lot of wonderful institutions in this country that deliver world-class care. The medications are perfect, the surgical care is pristine, the diagnosis in the cath lab and in the endo suite is phenomenal, but caring is different. Caring is a combination of healing and hope, and making people and families know that we really do care about them. We have a very simple rule. We're not driven by statistics or metrics as much as we're driven by the simple question: if one of our folks is caring for a patient, are they caring for it the same way they would care for a loved one of their own? And if the answer to the question is yes, then all good. If the answer to the question is not, then we need to do something different. And I'll close just by telling you a little story, if you don't mind. It was rather early in my tenure here. I got a call from a member of this community. I won't lose any names. It was 3 o'clock in the morning on a Sunday morning. And he said that he was having severe chest pain. He had previously had coronary artery disease and previously had a stent. And I sort of said to him, well, why are you calling me? Call 911 and I'll meet you in the emergency room. So I, put on my jeans and shirt and 3 o'clock in the morning and I meet him in the emergency room. His chest pain had gone away. His first set of cardiac enzymes was negative, but the decision was that they would admit him overnight and just keep an eye on him, which seemed like a reasonable thing to do. So I was waiting for a bed. If you've ever been in our emergency room, you probably know everybody's waiting for a bed. At any given time, I guarantee you, even today, there are 30 to 50 people that are waiting for a bed. No shortage of business in healthcare these days, let me tell you. And so I wandered up to the floor to the step-down unit that he was going to be admitted to, and there was this young lady who was straightening out the room, putting fresh water in the pitcher, and just making sure that everything was just right before calling down to the ER and sending this individual up. And so I started to talk to her, and she had no idea who I was or what I did, and I certainly didn't look like I dressed this morning, that's for sure, not at 3 a.m. And so I finally said to her, where'd you grow up? And the answer was North Omaha. And where'd you go to school? And North High. And what's your job here? And she looked at me and she said, well, I make sure that this is the safest hospital. Now, when you're, 19-year-old environmental services worker will tell somebody that they have no idea who is, that that's what their job is. That's a marker of the culture of the organization. And frankly, I will tell you that is exactly the kind of environment you want to educate the next generation of healthcare professionals in. The exact kind of environment you want to do cutting-edge clinical research in, where your only goal is to make sure that this is the very best that we can do. And so with that, it is exactly the bottom of the hour, and I was told that I had to be precisely on time this morning. I do want to leave a few minutes for questions, if that's okay. Can we do that? Sure. So if anybody has anything at all you want to ask me, if you want me to tell you about my grandchildren, I'll do anything you want. Just don't ask me about Husker football. I can tell you definitively that the Med Center's football team since 1906 has been undefeated. That is the year we lost to Benson High School, and they disbanded the team. There is some discussion about starting another team, although if you look at our experience in broomball and other areas, we've not been that competitive, but in the clinics and in the hospital and in the operating room, we win every day. Yes, sir?
So you made a comment earlier about staffing and staffing shortages and so on and so forth. I see one of the biggest threats to healthcare is what I call cannibalism from city to city for traveling nurses and physicians. What's your response? What's your reaction? What's the solution?
Well, I can tell you that workforce shortages, contract labor, etc., has been a major challenge for American medicine. As a matter of fact, if you look at the largest academic medical centers in the United States, the 100 and some odd that I just referred to, 95% of them had a red bottom line this year, particularly due to shortages of workforce that resulted in curtailed services, premium pay, and things of that nature. Fortunately, we've been in the black bottom line every year since I've been here, and hopefully we'll stay in that status, but only through very, very careful management team leadership. We peaked out, just to be very direct, at over 1,000 contract labor contracts during the time of the pandemic, and we're down to a much, much smaller number than that. A lot of that had to do with changes in the community. We have a good number of individuals who joined the traveling nurse, if you will, and it's not just nursing workforce, and then decided that they don't want to do that. They want to be part of an institution that they have pride in, that they know, that their family knows, that is prominent in the community. And so we have done much, much better in terms of retaining a more stable workforce. It's not to say, by the way, if any of you want to work for us, please just let me know, and we'll make that available to you this afternoon. But it is a challenge, and I don't know how much, per se, the rest of the country has recovered from that. It's a lot easier to do that in the big cities, where, literally on Manhattan Island, there are 7 large hospital systems. So literally you can throw a rock from one to the other. I'll never forget, there was a time in Philadelphia, and when I was practicing cardiac surgery, that almost half of the cardiac surgeons changed jobs and only 2 sold their home. That's because of the number of large programs, in these large metropolitan areas. So I think we're somewhat more better advantaged just because of geography. And also, frankly, this is a great place to live and to raise your family. And a lot of these employees are of age that they're having young children, and they, frankly, want to raise their kids in this community. And I get that. And frankly, that's one of our major attractors to hiring staff and leadership, is people want to live in this community. Other questions? Comments, thoughts? Yeah.
Once again, with regard to the employee situation and the healthcare workers in general, how has the Med Center expanded its student body so that we can have more doctors and nurses and so on?
Yeah, so we've had 23 consecutive years of enrollment growth across our rural and urban campuses. We're up 3.4% this year. And that cuts across, almost all of the specialties. Frankly, the largest challenge, believe it or not, has been in nursing, and we could spend a long time talking about that. But we are, because of our planning for the future clinical training sites, that is going to give us an opportunity to add another 25 to 40% to the workforce production per year. And we are the largest producer of workforce, healthcare workforce in the state. I mean, you go out to the rural communities, for instance, Amy would correct me if I'm wrong, but I think 90% of the dentists practicing in rural Nebraska are alumni. You look at the percentage of physicians, pharmacists, technicians, PAs, them is us. I crisscross the state all the time, and I always ask the same question when I'm in McCook or Valentine or Chadron or wherever I am. What are the first three things, most important three things that the university can do to help your community? And the answers are workforce, workforce, and workforce. And by the way, Jeff, if you're not listening, it's workforce. Now, it's different kinds of workforce. So there was a huge paucity of occupational therapy, so we started an OT program. There's a tremendous paucity of respiratory therapy right now in the state, and so we're starting an RT program. As a matter of fact, we were just accredited last week, and so the first entering class will be next fall. There were single-digit genetic counselors in the state when I came here, with a waiting time of over a year. So, you think about somebody gets a cancer diagnosis, somebody has a kid that has a genetic problem, you need to make an appointment with a genetic counselor, you think how it feels saying we'd love to see you, we'll see you in a year. Not so great. So what did we do? We started a genetic counseling program, and now we're producing genetic counselors for the state. And by the way, we're trying to hire all of them, but that's another story there. So, and answer your question, that is one of our biggest challenges, but part of that is to redefine the delivery of healthcare. And the use of technology and, frankly, the use of generative AI, what I call augmented intelligence, is going to be a very big part of that. It's not going to replace the human touch. It's going to enhance the human touch. It's going to make us more efficient, more effective. It's going to allow us to deliver care in small communities in a way that does not require people to have huge amounts of windshield time. I mean, you look at what we've done in some of our clinics with remote monitoring. I mean, we would have people drive in for 4 hours and 6 hours for a 20-minute visit to say you're doing great, and by the way, stay on your same meds and come back in 6 months. I mean, truthfully, that's not the best use of their time, and it's not the best use of our time. So things like telehealth, for instance, are extremely effective, particularly in dealing with mental health challenges across. We're one of the largest providers of mental health services in the state. We provide mental health services in every single county in the state, but we do it in prisons and in schools and in churches, and we do it through this communication modality. And believe it or not, if you look at our patient satisfaction scores, they're as high for telehealth services as they are for people that actually sit in the room with one of our therapists or psychiatrists or other mental health counselors. So we are trying to leverage that as much as possible. Yes, sir.
Under your leadership, I have read that the primary care program has dropped into, and I say that favorably, into the top 10. Are there any below the top 10, which is really a congratulatory thing for the Med Center? What do you attribute your ability to get these kinds of programs into that category, and any other programs falling into that top 10 group?
Well, rankings and ratings are great things, and indeed the med school was actually ranked clinically number 7 in the United States this year We have a number of programs. Our nursing school is highly ranked. Our PA programs are highly ranked. I could give you a long list. I'm not a big fan of rankings and ratings. However, I am a big fan of excellence. And philosophically, it's got nothing to do with me. It's got to do with putting the right people in the right leadership positions and letting them do what they believe they need to do. And the rankings and ratings follow. Sometimes they do and sometimes they don't. For instance, I'm not a huge fan of U.S. News and World Report rankings because a lot of them are reputational rankings, and they're not based on what you're really doing. Being in the top 10 by them is okay. I'm not going to complain, but it's, to me, it's again, it's at the end of the day, if that is your child in that educational program, if that is your family member who is involved in a clinical research trial, or if that is your loved one that is in our emergency room with a life-threatening problem, what we do in that situation is what really matters. The rankings and ratings will follow, and if they don't, you know, too bad. Yeah, one more question, I think, and then I have to hit the road.
Can you speak a little bit about the process for replacing President Carter and where that stands right now?
Well, that would probably be better answered by Regent Stark, other than, well, I'll tell you what I know. And by the way, it is, I think, a tragic loss for the state of Nebraska and an incredibly tremendous personal loss for me. I've worked for a lot of different university presidents, chancellors, and others during the course of my life, but Ted is an amazing human being, and I have a huge amount of respect for him. All I can say, having spent a decade of my life in the sovereign nation of Ohio, it's going to be a challenge, and I just don't mean on Saturday afternoons. It's going to be a challenge. So immediately after President Carter's announcement on August 21st, I remember that day like it was yesterday when Ted called me, and the Board of Regents convened shortly thereafter. They identified a process to identify a search advisory committee. They asked for membership of that search advisory committee. That advisory committee will go through a process. I believe they have, at the time of our last Board of Regents meeting, identified a search consultant firm, is that right, Regent Stark? And that they will do a national search to find the next president. It is kind of, I reflect on this a bit, that in my nearly 10 years here, between JB, Hank Bounds, and Ted, and 2 interims, I will have worked for 5 university presidents. I guess you'd say I've worn them out over the years. Yeah, one more, I'm sorry.
This is more about you. I could sit and listen to you for hours. I think you're amazing. I think you've deflected a lot because I don't think you give, I'm sure you give yourself credit, but not openly and publicly. But I'd like to know how you went from engineering and being a surgeon and having that instant gratification to doing what you do, knowing that you're not going to get instant gratification for all of these grandiose things you've done and want to do. What is it about you that makes you want to just do it for the long haul and know that you're not going to see immediate results for all of these programs you're doing?
Well, I could spend hours answering that question. I'm not even sure I know and have adequately reflected on it, but it sort of comes back to my definition of great leadership. I think great leadership is the knowledge, the skills, and the experience to inspire others to do great things. So one, inspire. That is to say, how do you inspire the best out of other people? And not to do average things, but to do great things. And I have never, ever been in a point where I'm interested in having the accolades or the credit. It is the very best thing that I can do. I'm not interested in having buildings named, or I'm interested in recognizing others for the things that they do and growing their careers. One of the reasons, one of the inspiring moments that changed my life due to my 9/11 experiences really were how to inspire others to have a career that I had enjoyed. If you look at my background, I would tell you that I grew up today in what you would probably call poverty. Neither of my parents went to college. Only one graduated from high school. I lost my mom at a very, very young age, and And in spite of that, my education and the community that supported me have really created incredible opportunities. And that's what inspires me to today, is to pay it forward. So on that, I do think I do need to run, but thank you. Thank you. Come visit anytime you want. We like to say social visits only, right?
Thank you very much, Dr. Gold. My name's Jen Tompkins, and I work for the Jewish Federation of Omaha. And as someone from Omaha, we are so proud of the Med Center. It makes us proud of the work that you do. And anytime that someone says they need something from their people, right away, we have the best. We have the best in the country, and we're so proud of it. So thank you very much. Thank you. Also, the Jewish Federation of Omaha, the JBL program is sponsored by the Jewish Federation of Omaha. We build, sustain, and support the Jewish community of Omaha and Israel. And we've had a lot of overwhelming support this week. If you would like to donate money that will go straight to Israel, you can go to jewishomaha.org. The button is right there on the front page. We've had so much support from the Jewish community, from people who aren't of the Jewish community, and we're really thankful for people and their support. So thank you again, Dr. Gold, and have a wonderful day.